Welcome to Electrolysis Unplugged, an after-hours chat beyond the probe with Joanie and Stephanie. We're here to dive deep into the world of electrolysis, education, and all things hair removal.
Whether you're a seasoned professional or just curious about the art of permanent hair removal, we've got the insights, tips, and fun stories to keep you plugged in.
So grab your tools, take a seat, and let's get into it. This is Electrolysis Unplugged, brought to you by the Electrology Education Coalition. Hello. You guys, thank you so much for just on the fly. I was very much stuck in limbo at the airport for a little while last week. And so I appreciate you guys being so willing to make this one a little bit longer so that we could talk, but you guys not miss out. So thank you, because I had to take a bus at the airport to a random spot on the tarmac at one of my things. And if anybody wants to know, I also got pummeled by a little kid on that bus and tooted on. So
hopefully by also the kid.
Hopefully by the kid as well. It was quite the experience. So I just wanted I would have rather been on the call with you guys. But that did not happen. I have our questions up here, but I wanted to start off. Are you okay? So I'm going to start off with a question that came in, and the person who asked that question will know that they asked it. And if they want to say that, oh, that's me, it's totally fine. But one of you has a patient who is on Electrolysis Information Worldwide asking questions about the process of electrolysis because they don't necessarily trust the consultation that came their way from their electrologist, which is not unusual. Just to put that out there, I don't know if you disagree, Joanie, but sometimes people come in and they've done the Dr. Google thing and they think that they know everything about this, and that they're going to tell you how electrolysis works, right? And part of this is this individual also got stuck with this patient interviewing other electrologists with conflicting
information.
So I wanted to start off with this because it is one of those ones that it's really frustrating as a technician to constantly, for lack of a better word, feel like you're hand holding just in a loop of the consultation process. And occasionally you're going to get individuals that it's going to take a long time for them to build trust with you. And I don't want you to get discouraged in that picture because it's unfortunately one of those weird things that happens. And I'm sure it doesn't happen just in our industry because I watched the girls on TikTok that are talking about hair consults for head hair. And they kind of come across the same thing. My person did it this way. I heard about this works better. And sometimes we get stuck as technicians in a space where they believe hype and sales topics from machine companies or needle companies over the science of what we do. Okay, so that's full disclaimer when I saw this question come through to me. But it will also be part of this is just talking about what happens when the person doesn't understand the process of electrolysis. So first and foremost, this question that came through, the person was like, why isn't it a one and done? Why do I have to keep coming back? Okay. And this is very much a summary. I can read it verbatim. Happy Sunday. I'm very new to electrolysis. I'm a client, so I'm learning a lot from this group. However, I'm confused about all the posts saying the hair grows back. Can you please explain how the hair grows back in the same follicle that it was treated? My understanding is that permanent hair removal method is at the root. Why doesn't therm or galvanic or blend work the first time? And what is the purpose? First time when the purpose is to kill the hair follicle so it doesn't grow back. I may be misunderstanding. I thought it took long because of all the hairs, not because of the same follicle being treated multiple times over a period of time. Any feedback would be much appreciated, and apologies in advance if my understanding is way off. I'm still learning. and you're going to be learning because you're not a technician for a long time. Okay. But this goes into that same question that you guys had posted before, which is like during a consultation, when someone's talking about removing in the anagen cycle, and that's the best to kill it in, like, why is that? And I'm going to have Joanie lead with her comment on this first, and then I'll come back in with my part now that I've read all that. And you can kind of like lead with this, and then I'll follow up with my initial thoughts.
Well, this goes a lot into, I talk a lot about this when I go through the staircase model, right? So when we talk about the different parts of the treatment plan, and you have the clearing, and you have the control, and you have the maintenance, what the poster was talking about is like, I thought that we were redoing, it just took a long time because we were doing a lot of different hairs. And that is accurate, but it's not the whole story. That to me really only happens in the clearing. So in the very beginning, like the first like 3 months or so of a treatment plan. That's when we're doing all of the hairs that are present and the ones that are below the skin that haven't popped out yet. And that takes time. It does. It's not one single treatment and then, I cleared your underarm and then now after that, we're just getting regrowth. There's going to be a period of time where we're getting new hairs and cycles that haven't surfaced yet. But I always think of it this way, we're going in with, and it's a very precise method. So we're going in with a filament inside the hair follicle. The hair follicle itself is filled with cells that are there to make the hair grow, right? We have to kill 100% of those cells responsible for hair growth in order for that hair not to grow back. That's our goal, no matter what technique you're doing. If you half treat a follicle, you leave one cell behind, or half a quarter of it on the upper part on this outside part of the follicle, or whatever else, you'd only treated the very, very bottom because you had a probe that was too insulated and the current didn't reach high enough, and treat the upper part of the follicle. Include reason. I did not treat the follicle 100%. And so the cells that are either damaged but not beyond repair or just left untouched completely will regenerate the hair. And so ideally, in a perfect world, every insertion I make is so perfect that I've killed every single cell that exists and that hair doesn't grow back. And I do believe that every time I'm doing a treatment, there are some hairs like that. I kind of say like around like 10% are just like perfect kills. But the bigger, deeper, more curved the follicle, the harder it is for me to reach that perfect kill. I feel like the thicker the hair, the more cells there are. The deeper the follicle, the more cells there are. The more curved, I can't even reach maybe the lower part of the follicle there. And so there's the chances of me leaving some cells intact just keeps rising, right? And so we see more regrowth. When the follicle is small, the hair isn't very deep, like you're dealing with like vellus hairs, accelerated vellus even, your kill rate tends to be higher. It's usually at about a 50% versus my 10. And so those we see clearances faster. Why? Because the follicle isn't as developed. So the chances of me getting 100% of the cells responsible for hair growth goes up. But the bigger the hair, the deeper the hair, the thicker the hair, the more distorted the follicle, the harder it is for you to say that you can do that. I remember getting into slight argument with an electrologist at we were up in Sacramento actually dealing with the rewriting of the test questions for the state board. And this was a couple years ago. And she was of the school of thought that every hair she does, she kills perfectly. And my question to you is, how do you know? Like, explain to me what X-ray vision or fluorescent tagging you have in those follicles that tells you that you never see a hair resurface after you've treated it. It's like, unless you've got the methods, you've got the scientific tools to be able to do something like that, I don't know that there's a way that you can guarantee that for anybody. So I tend to err more on the side of like, my insertions, I'm humans, my insertions will not be perfect every time. And so there is always a chance that a hair will regrow. And I think that the thicker, bigger, deeper, more curved the hair, the higher the chance of that regrowth is. So I kind of have them on a sliding scale, right? So you'll have like your peach fuzz on one side and your super, super thick hormonal terminal hairs on the other side.
Mhm.
And the more you're going on that scale, the more chances of regrowth there is. So regrowth is different from different stages coming in. So when we're doing that control, those 6 to 9 months after the initial clearing stage, it's like I compare it to almost like to a game of whack-a-mole. And so we're just kind of waiting on our regrowth. So the hairs that I've zapped before, they are coming back smaller. They're coming back. Why are they smaller? Because there's less cells. So the hair is just not going to be as strong as it was. And so we're just kind of waiting for those, and then we zap it, and then hopefully it's 100% kill rate, but sometimes it's not. And so then we see it every 3 months, we see a big reduction in the amount of regrowth because we're able to eliminate a good percent. But we say progressively permanent just because it takes time. And usually the thicker the hairs, the more complicated the case, the more regrowth I would expect. So
And
I don't think that it's one and done. I don't think that that's quite possible.
yeah, and I would lean in a little bit further and say that just as how do you know that you have hit your target? When you're going off of feel alone as an electrologist. Which is why we talk about fast electrolysis does not mean good electrolysis, because the faster you're going in your insertions, and when you're in a good like smooth space and you can kind of line it up and go up, 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 I think that you can have accurate, faster work in that space. But the fact is like, if you have somebody that is talking and fidgeting through a treatment, and that reduces your accuracy of your insertion. If you are treating hairs of multiple stages of size, okay, and density, and you have those factors as well. Expectations of client. We always know that like sometimes somebody will come in and they'll do their initial clearing, and what was bugging them is off of there, but then they see the undergrowth. And it kind of reminds me of like when your animals are shedding and they have like that shedding stage of all their hair. That's not like that. They're not hairless when that happens. There's always kind of something growing, and patients don't realize that until it's the worst stuff is out of the mix and the other stuff is underneath the surface. And then you have the expectation of in this case of not understanding that you might have an area where it, and I know that you guys have seen this in some of my lectures in the past, where we talk about the different areas of the body and how long they grow in their total life cycle. So if, for example, you're working on male pattern beard growth on someone assigned male at birth, okay, typically that growth pattern for the chin can be up to 52 weeks just in the anagen phase, which means that that dense growth that could have the distortion to it, could have more of the curl to it. They're very coarse, very deep set terminal hairs. That hair, if I hit that in the anagen phase when it came in, for just as an example, I now have to wait for the life cycle of that hair to reproduce a new one. And there are so many hairs present in that area that they don't realize that we have to do that on multiple waves of growth even before we can get to a control in that space. So like your clearances may look vastly different for a person that assigned female at birth with male pattern beard growth or assigned male at birth for male pattern beard growth, because the potential for what that hair growth looks like is going to be different. The timelines are going to be different. The amounts of testosterone usually are going to be different, or what's being controlled behind the scenes is going to be different. Patients that are going through medical journeys that impact their hair growth, whether that be something like PCOS or Cushing's or Hashimoto's or gender affirming hair. I mean, all of these little spaces, they impact what that timeline can look like. And so you have to be one Superman, whoever is zapping along, and be able to see through the skin to know that you hit all those cells on that side, which we're great and we're good at our jobs, but you can't call it 100% because you can't see into the skin like that. And then you have to take in all those other factors that I just said that lead to that as well. And I think the bigger thing when I saw this message come through, I was like, oh, my heart goes out to you, because it is frustrating when you have done all this hard work going to school and really getting to know the inner workings of a hair. And someone's like, well, why doesn't it work? I mean, we had a model just yesterday on the floor that I have gifted them my pro services as so that they can kind of see a relief in the cost for themselves, because their insurance didn't cover it and that kind of stuff. And like, oh, I've been at this a year. Why isn't it gone yet? And they have like a 10 of what they had originally. And it's like, you're 1 year in and you have 10% left. And like, you have to go and say, I understand that this is a process, and I am not a person that gives small timelines. I will always give you the worst case scenario in a timeline. And then when I deliver it in half, we're happy. Right. So my heart goes out to you. I know how difficult that is, but the best way to say it is, taking a little narrative in that space and saying that, yes, we talk about when is the best time to treat a hair. Well, the best time to treat a hair is when it's actively on your body. Okay. Now, how to treat that hair ends up with how accurate are you in your insertions?
And that kind of goes into like, we have to as professionals to know when, when a hair is treated properly. We can't see under the skin. So we do the best that we can. And so, your insertion was proper. So there was no dimpling. There was no, obviously no bleeding. Hopefully you're not bottoming out your probe. You're using the right size probe. You're using the right type of insulation. You're using, all of that kind of stuff. Then you treat the hair. There's no, the surface of the skin, there's absolutely no reaction. There's no blowouts. And then when you're removing the hair, you're not tweezing it out. This is a big one. I see a lot of electrologists tug the hairs too much.
Yeah.
I kind of tell my clients, and sometimes even the students on the floor, it's like, make it extra dead. Extra dead's the only good hair.
When she says no reaction to the surface of skin, I mean, what to expect is redness and inflammation, because that's how your body reacts. But like, we're saying that there's no excessive reaction. No. Yeah. Because like, you're irritating a follicle with, and I know that some of you are new on here, and it's like, I can't have a reaction. No. Like, what
I'm talking about, I don't want to see a blister appear
yes,
on, where the pore is, which looks like just a little bubble, right?
Yep.
Like, ooh, a little bubble. That's a blister. That's overtreatment.
Yeah.
If you're pressing on the foot pedal, you do thermolysis, you press on the foot pedal and you hear psh, 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 psh. Those are blowouts.
Yep. And that's why we adjust the energy. It's like, if we're hearing that, we're going, wait. Like, if it's one, I might be able to continue on, because it might be my insertion was poor in that space. But if it's continuous, like, make the adjustment. Your machine
change probe, change modality, try different things, like, you have to be able to have an arsenal, have enough knowledge to know what to do and how to adapt in these situations.
Very much so. Very much so. So I hope, sorry.
So this particular client, she's African American, curly hair. We're doing Brazilian and underarm. So
Holly
obviously,
herself saying it was her.
Oh, yeah, that's me.
It's not going to be a quick case, and it's not going to be an easy one either.
I'm worried about taking her on because she's been, I mean, I had the consultation, and then that was on like Saturday or Friday, and she didn't want to do. She's like, well, I want to go, meet with these other two first. One of them told her that she needs galvanic because of her, curly hair and like whatever. And I kind of explained to her, the V technique, because she wants to know everything. So I'm like, literally feel like she's a student, and I'm trying to explain to her why I can do thermolysis, and it doesn't have to be galvanic. And I said, I mean, all of them will work. Galvanic will take longer, for the hairs. And then I told her, and just because, it could take like 15 seconds per hair, and that doesn't necessarily mean she's going to get it. She might have to go retreat that hair anyways. So, retreating it with thermolysis just is faster. But she seemed like confident with me. She's like, yeah, I think I'm just going to cancel with her because she's been contact with her like via text, drilling her too with all the questions. And she says, and then she posted that question on the board, and then she told me she posted it, and then I sent you my response. Stephanie, was that
was, it
good?
was good. What I would just add into that is not, so in your response, hold on, I'm gonna pull it up real quick because I want to make sure that I'm saying the right thing. One, just include the fact that like when you're breaking down the follicle, you're going after stem cells. Like
Mhm.
that's
Okay.
so
Yeah. I
when
had told
she's
her that
hearing
in
the root,
person.
when she's hearing the root of the hair, that's basically what she's thinking is blood source only. Is
Mhm.
Yeah.
and that's because back in the day, you would hear people just say like, "Oh, we're targeting the blood source," and it was
That's
common.
half the information. Yeah, it was
like
Well,
half of a consultation.
Yeah.
So just make sure that you're including that. But outside of your response, outside of that, your response was pretty solid. And I would say that, yes, hearing that she was like, "Oh, I should cancel the other two," and she was confident in you. And then seeing her post afterwards, even though she was transparent with you and saying, "Hey, I posted this," it does tell me that she is seeking information from what she wants to hear, not what is accurate.
Yeah, and then
Colleen, I
Yeah.
would probably, like, if you're willing to entertain her as a client, I would probably set boundaries nicely in the beginning, but I would tell her, like, listen, like, I'm with you in this, if you want to start your treatments, I'm, more than happy to begin, but I need us to be on the same page, and I need you to trust me as a professional, like,
Yeah.
as far as how it's going to go, because you don't want her like every 3 months to be like, why is it still growing? Like, so
Right.
you're going to want to make sure that you probably like, I'm good to do this, but if you
Yeah.
start, it means that you trust me, that you understand what I explained to you, and that you trust in what I'm going to be doing.
Well, she did come back like yesterday. And then I did an hour on her Brazilian, which looking back, I probably shouldn't have done this. But she, like trying to treat two areas. Should I not do that? She was just like wants to do longer, but then it hurts. So then she like also wants her armpits too. So we ended up doing like an hour on her
So
Brazilian and an hour on an armpit.
it's especially if she's going to be like overly critical. Splitting the time means that everything will take longer.
Yeah.
Right.
And so I don't know that it's a good idea. I would probably start with maybe something that's easier, like the underarms. And I would do that first. And then once she sees it, and I tell clients all the time, like, electrolysis is addicting, because once you start to see that it works, then you want to do everything else.
Yeah.
And
so the problem
go ahead.
with the underarm, her Brazilian, I actually was getting good releases. It was, I was moving fast. So when I estimated her underarm, I told her, oh, I could clear that in like an hour. I ended up doing an hour and only got about a third of the way through, because I don't know what's going on with her armpit. She says that I couldn't tell if it was like a bunch of like piles of ingrown hair, because it was all smooth, but it was like all these black dots that were like substantially big, like as if they've been there, and there's like 4 or 5 hairs that are just curled up inside there. Like I wanted to pick them, but there was so many of them. And she also said that her deodorant like gets into her pores, and then she sits there in front of the mirror squeezing her pores, and deodorant comes out of them.
Yeah. I mean, it's normal for like debris to accumulate in the pores on the underarms, and some people, those cases will be worse than others. I sometimes, if I have a case where a client comes in with a lot of ingrowns, like, I kind of state that there's this situation on top of the hair, and so it's going to make the treatment longer.
Yeah.
But the end goal is going to be smooth underarms. But so it took you. So instead of an hour for both, it's going to be 6, but that means that you're getting everything properly. So it is what it is.
Yeah. And the thing is like, she's looking at you to quote timing, and then she's going to go on.
And that's impossible. Yeah.
And it's impossible, because the thing is like, you can have a really great day, and then the next, I mean, like, my last person, well, second to last person that came in today, they had maxed out their pain threshold, and they started getting really fidgety. Well, when they get really fidgety, guess what's happening? I'm poking them, like, because now I'm like having to predict where you're going, right? And so like just those little things, and it's like, even then, because they're going to be taking a break for like some medical stuff. Like when they come back, we're adjusting that timeline and how long they're going to be on the floor, because it doesn't make sense for you to be here for 6 hours when you pretty much max out your nervous system at 4, right? Then do a 4-hour session, right? Even if it takes me 6 hours to clear an area in that space, but you can only handle 4, you need to understand that your nervous system, you have to listen to that as well as like how the skin's going to react and that kind of stuff. So sometimes you come across like ingrowns, impacted hairs. You come across somebody that like doesn't grow it out enough or whatever. And what you would think would take you an hour does take you an hour per side. And that's completely acceptable, but they have to understand, like, once they start asking, oh, how long is this going to take? I go per treatment or overall, like, because they're going to change based on how you handled today's treatment.
The impacted hairs, or what I think are impacted hairs, is it okay to like pick those? I did suggest.
Yeah, I would clean them out.
I would clean them out.
Yeah, I would clean it out because it's just it's debris, it's skin, it's deodorant, like she said, like it's an underarm, so it's pretty normal for that kind of stuff.
Is doing like how they do back facials? Is that like a thing for armpits?
You could probably scrub them well. Yeah, sure, why not?
I have these little. The other day you were asking about Pauline about my post-care kits. I'm gonna see if I have anything near me. Kelly can, my student's over there practicing on herself. She can go grab one and I can show it to you. Those exfoliation gloves are really great for body work prior to. I would not do it close to your service. So if she's coming, thank you so much, sweetie. Oh, is the glove in here? Yeah, it is. Okay. So this, you're gonna see my backdrop just look a mess. It's fine. We're still kind of moving stuff around. So this is like my post-care kits. They kind of come with a post-care, like if they're going to be doing face work, like to clean off their makeup prior to that, just put that in their purse. This is an expanding sponge for like cleaning their face after electrolysis. This is post-care cream. That's for like the heavier duty stuff. And then behind this, and the card is in there, okay, is one of these gloves, okay? Now, these gloves are amazing for those kind of areas. So like if you had somebody that had like a lot of hairs that were still like, they were a shaver, but the hair's always kind of, I don't want to call it fully ingrow, but they kind of like loop just kind of back onto the skin and you kind of have to pick them up. This is what I would use that for. For your forearms, this is what I would use this for. It is not for your face. Do not go buffing your face with this or apricot scrub, like just don't be doing that to yourself because you're going to hurt real bad. But I would say that like within a few days of the service, not the day before, because your skin's going to feel pretty raw. And then I would say instead of doing like a creamed deodorant, I would go to a spray deodorant so that it's a lighter layer and it does not get so impacted in there. And then for her, I would say the day of her electrolysis session is to do like a warm compress underneath that area so you can kind of soften it up. And then you'd be probably good to go. Anaphoresis if you're allowed to do it in your state as well.
And when you're telling clients to exfoliate, sometimes I tell them like an exfoliation isn't just like a one-time thing and then do it as hard as you possibly can.
Right.
It's more of like a, like you get into the habit of doing it. So it's going to take probably a couple of times of you exfoliating an area before that you start to see that it's like actually doing something. So you have to soften up. So I would rather they do it less aggressively, but more often than to try to peel off 6 layers of skin in one shot, just because they just remembered right before coming into their appointment.
The, those, I think they're called African scrubbers. They're like all over TikTok. And I'm always like, okay, yeah, super cool, but not right before your electrolysis session. Like I'm okay with you. Like if you went to a Korean spa, also super cool, just not right beforehand, right? Because it's going to buff you out so bad that like the electrolysis itself is going to be more reactive.
Yeah.
In that space. But
there's a little comment here that we can kind of read maybe. So it says, in my area, there's 2 galvanic only users, 1 outs down other methods on her website. Oh, so she puts down, okay.
Probably puts down.
Yeah, puts down other methods on her website. The other states first time kill is 90% kill rate. Do not know how to respond to those clients and bring up others' information. This is good help. I mean, it's common. It's a fallacy. I think that we can kind of, I know most electrologists that are worth, the money that they're paid will be in agreement that all three methods are valid and permanent methods.
Yep.
The skill of electrolysis and permanency is so much more related to your accuracy than it is to your machine or your technique or your whatever it is. A good electrologist could work with anything. Now,
Yep.
obviously, different machines will offer you different pluses and minuses, pros and cons, different probes. We adapt. Technology nowadays is better than it was in the 50s, 60s, 70s, and 80s. And so we move forward with the times. So, I would normally so with the first one that puts down other methods on her website, I mean, you're probably not going to convince her to stop doing that. I would try to educate my client as best as possible, tell them that all three works, and, just let them kind of come to their own conclusions about what they think about that. The other one, 90% kill rate. Well, again, it kind of goes into, I'll explain why she came to this conclusion. And that's really the thought that with galvanic, because you're producing lye, which is more of a, like, I want to say liquid-ish, it fills more nooks and crannies than the thermolysis does. But my rebuttal to this always is that thermolysis, yes, it doesn't fill a follicle like galvanic does, but the lack of success with thermolysis has more to do with your precision.
Yeah.
So with people that do thermolysis have to be precise. If you need to put the tip of that probe exactly where you need it to be, and then there's virtually no difference. Okay. But if you are not an accurate electrologist, you're probably going to need the galvanic and the blend to help with the fact that your probe isn't exactly where it needs to be.
Yeah. And like when you guys hear me talk about utilizing galvanic and blend in my practice,
and she does,
and I do. One of the big reasons that I do that is when I'm having to work with distorted hair follicles. When she was talking about sometimes you can't get your filament to where you need it to go, there is a added benefit in that space to be able to use that lye. Now, I am a firm believer. Like when I say firm, I am a very firm believer in, this is the reason that you hear this, Melissa, is because it's all about who your teacher was. Was your teacher hyper-focused on one modality? Was their teacher like open and accepting to understanding more? Why do they have that as a thought process over anything else? Now, you're not going to change the mindset of these individuals, but what you will do is you will be able to change the mindset of the people that come into your office, because one of the big things that Joanie and I talk about this all the time, sometimes we'll see this on the public information page. When someone is like, the only method that works is, and then insert blank. And galvanic is probably one of the ones that we hear the most because of the age of the technology, and so there's like this like thought behind like, oh, it's the OG and da 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 da. And like, as a practitioner, when I hear it's the only thing, what happens when you have a contraindication? So you telling that patient that they can never have electrolysis ever again because they can only have galvanic because that's the only thing that's permanent? They're only going to have a 90% kill rate if they're only in that modality. Is that what they're saying? Right. And so that is one of the bigger things that we get frustrated with, because you're essentially telling somebody that you're the only way to achieve these results. And that's your marketing technique? Or is it truly what you believe? Like, why is that your narrative? Not that your narrative, but like, why is that their narrative? Right. And it comes down to usually on their training. It usually comes down to their teacher said this is the only way to do it, and this is what they believe. And in our world, like, the only way to do it is the way that you can accurately get that filament into the follicle and kill some hair. Like, I don't care how you do it. But yeah, like, I mean, that's why do I do those things? I do them because I want to play with my tools. I want to try all my options. Outside of that, all of them work. Right now I have 2 new students on the floor and they're having to do all the slower modalities right now, which kind of cracks me up when it comes to these kind of things, because it's like then they get really happy when they get today Kelly's having the best day of her life because she's on Flash. Like,
Yeah.
like when you don't entertain other modalities, it's difficult because you're basically telling yourself that I'm not willing to do critical thinking. So I'm like, there's my soapbox. Today, we want to shine some light on some of our amazing partners who are helping shape the future of electrology education, services, distribution, and so much more. We're thrilled to have such amazing partners and supporters. Whether you're just starting out or a seasoned professional, these vendors and schools have what you need to succeed.
Hello listener, this is Hazel Bloom with Kiwi Fruit Coaching. Just a quick message this week. I just wanted to let you know that I have support groups that I run online for free, and they are open to members of the LGBTQIA+ community and its allies. If you or any of your clients need support, we have a quickly growing community that is helping each other get through a stressful time. Please go to kiwifruitcoaching.com/events. There is a link to the online community and also information about our in-person groups in Centralia and Olympia, Washington. That's kiwifruitcoaching.com/events. Thank you for listening. Stay strong, stay sane, and stay safe.
The North American distributor of ballet needles and Instantronics is none other than Synoptic Products. Every electrologist knows that precision matters. Ballet needles are designed for just that, offering unparalleled accuracy and comfort for both the practitioner and the patient. Instantronics is known for the smoothest hair removal experience, and distributors who are enthusiastically moving towards innovative experiences with their new ownership under Dr. Sarah Paisner, Instantronics, formerly known as Instantron, is making strides towards innovative experiences in electrology epilators. You can ensure that your practice not only remains clean, safe, and compliant, but on the leading edge of technology and innovation. A must-have for every electrology clinic. Visit synopticproducts.com to learn more. Looking for education in the middle of it all? Head over to the Midwest United States to Illinois Dedicated Electrology Academy. The idea is building strong foundations for future electrologists. Their small class sizes, expert instructors, and modern facilities make IDEA a top choice for students seeking high-quality education. Your career in electrology starts here. Welcome to IDEA.com. That is welcome to IDEA.com. Thanks for tuning in to Electrolysis Unplugged. Be sure to check out our amazing sponsors for the best in electrology tools, training, technology, and so much more. Now, back to the show. If someone has a lot of hair, can they come in for a few days in a row for their initial clearing? Now, do you want to start this or do you want me to? Because I did a lot of large volume clearance for a very long time in my practice. And we used to have people fly out from all over the world and do like basically what we would call like, full clearance. They would come in with
marathon sessions.
Marathon sessions is another way you hear that, but it's a big session. And they would do multiple days in a row. Now, why did I move away from that model? It's pretty taxing on the skin. I did not like how long the downtime was. And for myself, I need to get back to life a little bit faster. So doing multiple days in a row, while you can do it, you really do need to look at how the skin is holding up in that space. I personally do not like doing this any longer. The reason I don't like doing it any longer is I'd rather go for a feather technique, which means we're going to thin out the hair. It will help with keeping the collagen and elastin at a space where it can regenerate and heal in that space. It allows your follicles to contract at a slower ratio so that you end up with less of that fine line look over time, because remember, that's volume. And when we talk about volume in this space, and this is like my other teaching moment. When I remove a hair from a follicle, let's see, blur my background. This is my hairs, right? My little disco ball hairs. Okay. Now, if I remove a few of these, if this could come and tighten back up, every time I remove a few, this gets tighter and tighter without losing its integrity. Okay. But if I take out everything at once, okay, the speed in which this has to heal is, or not the speed, the timeline in which this has to heal is much longer. And it's going to take a lot to recover the body. And so removing a little bit at a time allows your body to recuperate at a rate that allows your follicles to contract and return to a pre-terminal hair state. So before you got a beard, it allows your face to look like it did in your prepubescent years.
I've always been a little bit more conservative when it comes to doing, like we all use beard clearances because it's the face and it's thick hair and it's dense, right? So that's usually the situations where we're feathering, we're kind of like just going through, but not clearing everything 100%. The big thing that we have to remember in dense areas is not just the damage to the follicle itself, but it's also the damage to the skin in between follicles, which tends to be doubled. So like I kind of like to do, I'm going to get my little whiteboard because I just want to do a little drawing here. And I'll use my finger. And I'll just kind of do two. Okay, 1 second. It's thinking.
All the enable cursors.
Okay, so it's doing, so if I have two thick anagen hairs, one next to the other, and I'm going to change the color here, and I'm coming in with my probe. Let's make it blue. So I'm coming in with my probe. Let's make it thicker. And I go in here. Then after that, I'm going to go in my second hair follicle. So I'll just draw it right now. And then I'm going to deliver the current, right? So here's my teardrop. And I'm doing this. Then I'm going to do it on this one too. And I'm doing this. Usually my settings tend to be higher because my hair's thicker and so it needs more energy. And that means that my teardrop pattern, if I'm doing thermolysis, is going to be bigger. If you're doing galvanic, well, more lye is being produced. And so it's going to spread more into the surrounding tissues. And the issue is not so much with the follicle that you're treating, but with what's happening here. And so in between these twin follicles, you're double treating that tissue. And so sometimes you could be doing a little bit too much damage. And that's, I think, where the issue ends up being with doing too aggressive of work at once. Obviously, loss of volume is going to be one because, like Stephanie says, hairs do take up space. And that space, if you don't give it time to fill back up with collagen and elastin, it's just going to look flaccid. But also, if you go too much, you risk over treating and causing pitting and things like that because you're double treating the spaces between two hairs. So we feather so that we can spread out the damage that we cause so that we're not double treating areas. This is also something that happens with lasers, right? And so like this
in
double
laser,
treatment.
it would look like this. So, and this is, I'm using my cursor because I draw my that thing, but like, so when you pulse over the top of an area, if you do not overlap, okay, you'll end up with half moons of hair that they leave behind. That's when you have somebody come in and they have that little, like, they look like little moons of hair follicles left behind because there was no overlap. But with laser, you can only overlap for about 20 to 50%. And the more overlap you have, okay, obviously the more energy that's placed in that space in a double time. So like if I was at 50%, every one of these would be basically 2 pulses per area. And while you might have a lot of destruction of the hair, you also have a lot of possibilities for hyperpigmentation. That thermal relaxation time cannot occur in a positive manner. It takes a lot longer for it to go down. And you really want your skin to recover from a laser treatment, usually within 48 to 72 hours. That's kind of like the nice window where it shouldn't feel more than a sunburn after that point. But the more you're overlapping in this space, the more chances, well, you might not miss as much stuff, the more chances you have of that happening. So if I had 4 pulses next to each other and you look at these 4 dots, right? And I did 20% on all of these, all of them, especially this middle spot right here, is getting hit 4 times. And so that's a lot of focused damage when the target's gone, because I've just used it to obliterate the stem cells.
Okay, click out of this.
Okay, so let's see here. How do you plan to prepare for client cancellations? What are you doing within your practice to help prepare for client cancellations?
I mean, aside from setting a fee and actually charging that fee, honestly, I don't know that there's really anything that you can do. You have to have your policies in place and you have to enforce them. I think that that's the only way that you can really do that. You could charge deposits, obviously. So start deposits ahead of time. People tend to respect things that they have to pay for more than not. So that tends to help. But not every state is going to allow you to honor it. Sometimes clients can do chargebacks on deposits. Some states' laws say that you can't charge for services not rendered. So you have to also see, if that's something that you can do or not. But just you need a no-show policy. You need a cancellation policy. Make sure you have your waivers in place. And so people are signing off on these things. Take a credit card capture if your system allows for it. Charge a deposit if you're able to do so. And, and then stick to your policies when clients are abusing it.
And understand that if they're not willing to adhere to the boundaries that you set for your practice, they're probably not a client that you want to keep in the schedule. And I hate saying it like that, but like if somebody's always going to challenge that, they have to understand that it takes 4 days for that hair to grow out. Even if I have somebody on the wait list, most individuals are not just sitting around with unwanted hair on their face or wherever that is, right? So they're not just sitting there going like, like I'm just waiting. Now, occasionally, like I can convince a few of my clients to maintain that, right? And they're kind of my go-to, like, hey, I had a cancellation come in, but if and like Joanie and I've talked about this with you guys when it comes to like the staircase model and your treatment planning for business success, like in those spaces, we're talking about like these individuals have pre-planned all of their appointments. So why would I have people waiting on a wait list to fill a one-time appointment and have it like them have a successful treatment plan? They should have multiple sessions already booked out with me, so that they understand that we're committed to the process together. And if they miss an appointment because they canceled, then they have to wait until their next appointment, unless I have a cancellation. But you really have to set very firm boundaries. You are worth those boundaries when it comes to your practice. It's not like you're doing something that's unethical. And eventually those clients that cancel out on you, reoccurring cancellations, they see themselves out the front door.
I had to do that just recently. I had a client that was pre-booked, and so I'll pre-book like the full year. But I do have, like if you are constantly, even if you're you're outside of my 48-hour period for cancellations, if you cancel me a few weeks in a row, so you're not sticking to the treatment plan, I actually delete all of your reoccurrings. So, like pre-booking in my schedule is a privilege. And that also means that I'm not giving this spot to anybody else. And people are booking very much in the future. If you were at 5 p.m. every Friday afternoon or every Friday evening, then that means I can't book anybody else for my 5 p.m. Friday evening spot. And that's a popular spot. And so if it's the third or fourth time in a row, even if you are outside of my cancellation period, which means that you don't get charged a fee, but you are canceling and I can't fill that spot because, just like you said, clients already made plans, it's Friday evening. Then you're off my books. Call me back when you can figure out your schedule.
In those
But
cases, I even
no
check
way.
in with them and ask them like, hey, is there a reason that we've had reoccurring cancellations? Do we need to reassess like what your commitment to the plan is, right? Because I'm showing up, right? This is my job. And I will always be at my job unless I'm sick enough not to be, right? But like I'm here and stepped into that role. And if you are dropping out, you might have had a shift, whether it be a financial shift. So say, for example, something happens in your life that you can't afford to do regular appointments. Let's talk about it. Let's see if we can make this more affordable for you. Okay. Mm-hmm. It could be that you're kind of burnt out. That one client that was getting fidgety today, I was really grateful for the fact that like she gets to have a gap right now when it comes to like her services. And like to me, that will kind of generate her excitement to showing up for appointments. And then not to mention like the reason we're taking a gap is we're having a surgery coming up, right? And so half of that time won't even be needed anymore, right? So that burnout goes a little bit away. And so you have these moments where it's like, it's okay to check in with them and say like, what is happening? Like, and if they're like, listen, I'm busy, I can't do this, then I'm going to drop you out of the schedule. Let me know what the busyness looks like. And then we can see about putting you back in because
it's not trying to be mean, right? It's like my issue with the client that I had was that she started a new job and, you know, she just couldn't figure out her schedule. So things had changed. I mean, and so I understand. I said, it's fine. I get it. Like it's a new job. You're trying to figure it out. But the fact remains that you are messing up my schedule every week. So I said, that's fine. Figure it out. I'm going to take these appointments off. When you can figure out what your new schedule looks like and you can recommit to something, then I'll put you in. And that doesn't mean that she can't text me on Friday mornings just to see, hey, what do you have this evening? Just in case. I'll take you last minute. You can go online and book your own 2 days from now, right? So there's you can still book appointments. I'm just not going to give you a scheduled spot for a year if I don't know that you can make it.
Melissa says, do you have policies posted big in the office? So currently, I don't have the policies up. I did have them posted for a long time, but since we just moved into our new space, there is stuff that has gotten feet in the office, and they will go back up, but they do go on. So like when you book an appointment, and it says like, please arrive 15 minutes before your appointment to unwind before we get started. It'll say on there, like, these are our cancellation policies, that you've agreed to. Like, if anything changes, please let us know. And then they know that they can get a hold of us through text message, through phone call, and through email, that they have 3 opportunities to get a hold of me. At the worst case scenario is you send a text message, I see it if it's in the window or not. And then I can go, okay, I'll see you next time. Or, okay, but it's $35, right? In those spaces. And it gives us just an opportunity to kind of check in with each other. As for like, we're going to be revisiting what our cancellation policy looks like, because times have changed. And I do feel like our policy is a little outdated. And I just want to see what the next, I need to evaluate what that looks like. So when that happens, all of my clients get an update saying the policy has changed to X, Y, and Z. It will be effective as of this date. And I usually give them 3 months to understand the effective date.
I just did that. I went from 24 hours to 48. And I created a like just a waiver, a notice of change, you know, like a notice of what did I call it? Notice of change in policy. And then it was just a couple paragraphs that just kind of outlined that, you know, we go to 48 hours. So I drafted all this stuff, and there's like 3 different places that they have to sign. It's all electronic. And so I made it so that it was mandatory for any client that is on the books that they have to have one of these waivers on file. So it shows, I have a little icon that shows if they haven't signed it, and I can send it via text, via email, right, until they sign it. And pretty much it's just like, they can't say, they're like, well, I didn't know about it. And then of course you update like your appointment confirmations. There's usually a spot where you can put in some policies and no-shows and cancellation policies. And so in there, It's also in there. So when they book an appointment, it's part of the confirmation email that they get. I updated my intake forms to all that stuff. So it's kind of everywhere. I don't have it posted though, mainly because I don't know that I have the space for more like clutter stuff. So like papers, they're not gonna see it even if it's right in their face. But they've received it in, text message, they received it via email. So all the different ways I can send it.
I think that is a good question to have though, because it's like I'm with you on there's so much stuff that goes up on the walls, that goes up in the office that I'm like, oh, that posting a physical copy becomes a little difficult. There's a layer of this and I'm sure you have this as well. I lucked out and my spouse works with me at the office and he is on top of those books. He looks at that as like, that is money in, money out kind of thing. And so when there is a policy change and if somebody has not adhered to signing off, they don't even get pulled back into the service until it's signed.
Mm-hmm.
Yeah.
Yeah.
It's like
I have a tablet at the office and I told all the staff, I said, if it's not signed, you say, we have a notice of policy change. Just please read over this, sign it, and then I'll take you back.
And if they refuse to sign, what would you do? Exactly. A refusal to sign in my business is a refusal saying I self-selected out of the schedule. Like,
yeah, it's a policy that I have. I mean, if you're like, whether you accept it or not, that's how it works now. I have fight back too about I collect ID cards, photo of ID cards. It's added to their intake forms, and every once in a while I get someone that is just like, why do you need that? What's that for? But it's one of those things, sticking to your boundaries. And so this is, I see this is also a medical office. I see insurance patients. I keep, so I check everybody's identity that comes through here because we're exchanging money in this place, right?
And I will tell you guys, I don't know if how many of you know me from like a long time ago, but back in 2018, we had a Botox and Dash at my family's practice. They got services, had a car running outside, had a getaway driver, and like dipped out on their Botox at the end of the service. And then we had another one do it with Juvederm afterwards. And the fact is like, I need to know the name on your intake form is who I'm dealing with. And it does, like, say, for example, like someone has changed their name, but they haven't changed it legally. I also need to be able to know that face on the ID is the face that is in front of me. And it's just a matter of protecting ourselves because you're doing a service and you're not getting paid until the end of service in most cases. It's not like they're paying when they walk in the door, because if you end up going over, right, what does that look like? And so it's really important for you to know who that is. And so I'm with Joanie in this. And they will fight back on it, but I do medical. I need to know that the people who say that they are, who they say they are, because in the Botox case, we were able to prosecute them because a couple different things. One, don't cross somebody back in high school because they will find out that you did something shady. And one of the girl's ex-friends from high school saw the post about her running off from her Botox tab and turned her butt in for some discounted Botox. She had no problem with it. She was like, bye. But they had repercussions. They had to pay restitution. So it's one of those things, like, I had to feed a nurse, like, she still did the work, right? In that space. What am I going to do? Not pay her for the job that was lost? And it was like during Thanksgiving time frame. And it's like, you just think about all those things, are protect yourself.
Yeah, and I wouldn't, like, you can be nice about it, but it's one of those things. Like, the biggest one I hear is like, well, I went to so and so's place and they don't ask for IDs. I said, that's great, you can stay there. I mean, we do here, so it's. I've had, situations like I've had creeps, right? So it hasn't happened too much, but with more of us there are in the office, the more clients come in, the higher the possibility of creepos coming through, So I've had some creeps, and in all honesty, if you have their ID, it's going to be a lot easier if you need to file a police report when you actually have the person's identity. I also have security cameras in my office. They are not in the treatment rooms, but they are in the common areas. So the hallways, the reception area. So, I have like that kind of stuff. So I had the footage of the person. But in the treatment rooms, we don't have any video of what actually happened. We just have, incident report from the staff, but at least I have the person's client file and I have the person's ID. So
It's so important. And it's okay to like establish those boundaries in regards to your cancellations and whatnot. Okay. One of the questions was, what do you feel is the benefit and differences between essentially having your own practice versus working for a practice? And what do you encourage new electrologists to do? For me,
and that actually can kind of go into, I'm going to read off a question that was submitted.
Okay, perfect.
Just so that we can also kind of go into that. So this is an electrologist who is moving, and they want to know any advice on moving your practice or trying to make sure your old clients are still in good hands. So we can kind of talk about also like what happens with your clientele moving from one place to the other. And then it goes into people that come into your office to maybe take over, or how that might look like.
So, I mean, I just did that. So, when I was offloading my Arizona clients to my girls in the office, I established bonds with each individual that was on my table into their new technician schedule, and just kind of ushered them through the process. And I also explained to them like they had options. So even though I was trying to find them like a great fit for their personalities, in a weird way, I would say that I have an adaptable personality. So whomever's on the table, I can usually find commonalities. And I think that comes into like how long we've been working, right? So like you find common spaces to connect with them, but not everybody does that. And so sometimes you have to find people that are very like-minded. And so I basically found people that I connected with in different ways and put them into the technicians that would have a similar personality, and then helped in that ushering into their new schedule, because you can't guarantee they're going to stay in someone's schedule, especially if you were to sell your practice to somebody else. You can't guarantee that the people that were in that schedule are going to stay there as an asset to that business, because they might want to sample somebody of their own choice, right? Versus somebody you chose to sell the business to. So it's important. Like I created kind of like a bond between like, hey, like here's this discounted for service with them. See if they, if you two like working with each other, I have a few referrals for you. So these are what these referrals are going to look like. And I did that kind of like enough time before I left to give them an opportunity to weigh in with me, like their experience. And then the new technician also gave them on the next service with them a discount to kind of keep them in that space, because it's not just like a one time and you get used to somebody. Sometimes it takes a few sessions to find that comfort. So that was there. When it comes to like starting my own, like starting an own practice versus working for a practice, I've done both. And I will say that they have vastly different reasons to why you do it. When you start your own, it's about finding your identity within what you want your practice to be like. Whether your identity is to work for yourself for the first time, have more flexibility in your schedule, whatever that looks like. Not having a very customizable schedule is a big part of being a sole proprietor. Working for a company gives you security. So when you first start out, especially when you first come out of school, and you're looking at filling a book, dedicating some time to an established practice will give you a book available. I would not say that when you're ready to go on to your own, do not coach the clients from this book. Ethically, that's just not a
You
sound
just don't
thing
do
to
that.
do.
Yeah.
You just don't do that. And so you would still have to establish your own when you go on to your own if you decided to. But it's very important to have that soft space or soft place to land when you first come out of school if you have never worked for yourself before, and there's a lot of expenses that go into starting your own business. So do you have those startup costs, or would it be easier for you to lend your expertise into a practice that already is established, so you don't have those same hits coming into it?
Yeah. And being an employee has its own perks, right? For the most part, different companies will do things a little bit differently, but you're probably going to just come in and do the work that you're supposed to do, right? The electrolysis, and you go home. So maybe your insurance is actually taken care of by the company, right? You're under the umbrella of the practice. And so that's an expense you don't have to worry about or take care of. You might have benefits, right? So like at a minimum, we have in California 40 hours of sick pay, right? So this is something that you don't have as your own, when you're your own boss. So if you're sick, just too bad, right? You're not getting paid for that. Some companies might include vacation time. And so maybe you can actually take time off and be paid for it, which is great. That being said, also, if you work with more than one person in your office, it is so much easier to go on vacation because there is somewhere for your clients to go. And there's nothing worse than it's hard to take time off when clients are used to coming in such as like a strict interval, right? So if you're seeing clients every week, you going off for a month is just, they're not going to be happy. But like my staff's able to do that. Like one of them, I want to go to Australia for a month. Okay, well, your clients then go into other people's schedules until you come back, and then it's no big deal. Yeah. So it's a lot easier sometimes for stuff like that. A company might also offer like training opportunities and special classes, and send you to seminars. Like we had the group from Texas that came, all paid by their employer.
Same with Silky.
Yes,
Food.
yes,
Same
yes,
thing there.
up north. Yep.
Yeah, and like I look at that as continued education is a larger expense in our industry, especially like annual, and if you're traveling for it. Definitely great write-off to have there, and great benefit when you go. But when you work for somebody, in many cases, you'll either get a discount towards going to them or get it for free, depending on what your contract looks like with that employer, which is huge.
Yeah.
The health insurance alone is huge. And I look at that as almost like I know that there's I can't think of what there's like a law in the sense of like what you're supposed to cover per state and how many people and how many employees. But like health insurance as like a small business is going to be exponentially more expensive than when you have a team of individuals there. And that is an asset, especially in a larger company. It's an asset that you can't really replace. With my spouse and I working in the same space, I mean, we had to look at a much different way of having health insurance and vision and dental and all that kind of stuff. And I mean, it is what it is expense wise, but oh my gosh, was it easier when you worked for somebody? So
some of the cons though might be that like you don't really know sometimes, like you work for humans, and so personalities might be different, and so sometimes you just don't know the type of boss that you might have. You usually have to request your time off, right? Not everybody might be as lenient, so there's those situations. And sometimes when you get hired by someone, they expect you to kind of fit into their culture and their way of doing stuff, and that might not align with what you like. So there's also these types of situations.
Definitely all of those apply. Know the culture of the company, research it, talk to people that have worked there previously, get to know the company. A lot of our longtime employees actually were people that were on the table as getting services initially, and they got to know the vibe of the office before they became an employee, which I always thought was like, I'm like, we're being interviewed. Like you don't even realize it, but you're being interviewed on your end as a employer or manager of a company. But it is a thing. I mean, I say to the girls all the time, I'm not peanut butter. Not everybody loves me, right? Like I'm not a Reese's peanut butter cup. Like it's not always the case. And some people are allergic, right? So like, you have to think about those things. Like, are we going to be able to please you? The thought of like, everybody's cup of tea or shot of whiskey, it applies here. You got to figure out, which one is going to work best for you. As when you're working on your own, when we think about the cons of that, the startup costs are higher, right? People will call Joanie and I, and I'm sure Eileen too in this space. When we have somebody that comes in and they're like, how much is school? And they're only thinking about the cost of tuition and not all of the other subsequent costs just to start, right? Eileen, I'm sure you have this happen, but like we had someone that was like, well, I can't afford to take time off to go to school. And I'm like, how did you expect to go to school? And then, and when I'm talking about like cost of living in the area or how long it's going to take you to get through the program, what did that look like out of your schedule? All of those apply into this space.
Very true.
Yeah. And then working for yourself, you have to make sure that you are doing all of the business owner stuff so that you are making sure that you're putting the money aside correctly, doing your accounting correctly, paying your taxes, getting the right insurance and the right licenses for everything that it takes, so it's not just I'm going to go rent a space and put a bed in it and then I'm good to go. There's licenses and there's a lot of people that want a piece of your money. You find out really quickly how many hands are in your pockets, so from the city business taxes to the licenses from your boards, if you have some, to the obviously the just income taxes that you're going to have to pay and all the other stuff that goes into it. So there's going to be a lot of things to keep track of. And, then you just have to make sure that you're okay with taking on that kind of liability.
Yeah. Eileen, what were you going to say, hun? I saw you pop on.
I think I might have accidentally hit the unmute button by mistake, but everything that you have said is true. It's like, you have somebody, I have two right now. I had one transfer from Joanie, still waiting.
Still waiting on her to finish
my
up
money.
Oh.
And she says, well, I can only come on Saturdays. I'm like, okay, it's going to take you 50 weeks to finish this course.
Yep.
If you,
I just had one. I just had a graduate. She came last week to pick up her proof of training and she was a Saturday only person.
Yeah.
I've done a few. I had a Saturday mornings only person. Took her 2 years.
Wow.
But if they're, as long as they're there and they're dedicated, they'll get it done. It is what it is.
They'll get it done, but they take up a spot, because
sure
I'm
do.
only allowed to have 10 students at one time. So that's taking up valuable.
Are your Saturdays a popular day?
You know what? They were until the weather got really nice.
Oh,
Now I'm having troubles getting the models to come in on Saturdays, but
Oh, funny.
you're like, come back.
yes.
Yeah. That's, even that's a struggle. I'm one individual, right? And so, right now, and I think about those, spaces where when people are like, you don't have nights and weekends. Well, right now, no, like one day that will be a thing. Right. But like right now you get me when you get me, like,
Right.
and that's a struggle. And I definitely acknowledge that, but it's one that I have to do for this season of my life. And that's important to tell people about. The girls today, I was sitting there because I had somebody like in my inbox being like, mad that I was less accessible as a school than they wanted me to be in that space. And I'm over here like trying to like be like, I'm important. and they're like, yeah, that's why we chose you. Like, and you have to remember like that you can't be everywhere all at once. And when you are your own business owner, you do have to delegate, like, and because you can't be everywhere. You can't be the bookkeeper and the accountant and the cleaner. Sarah Paisner had a talk at this last lecture where we talked about that. Like when you start whittling away at all the things that all the hats that you're wearing, right, in that space, you start going, okay, what is my actual what am I actually making in that space? And it's about hiring the right people so that you can make the right money in that space to value your time. I had to unfortunately I want to say fire, but that's so mean of me to say. I had to fire the cleaning company. Why? Because they accidentally threw away patient documentation in the big garbage can outside without shedding it. And somebody got into the garbage can and the documentation was everywhere. Now, mind you, this was like a pile of papers and like there wasn't a lot of what I would consider private information on there, but I can't keep you. Well, guess what's happening right now? I cannot find a cleaning crew. And guess who gets to do more cleaning? It's
and I guess that's a thing with owning your own business. You know what I had to do a couple weeks in a row? Go plunge the toilet. I was the toilet plunger. And so that's what happens. You want your own business. The toilet doesn't flush. All right. Go get the plunger
I
and
have
start
also
going
had
at
to do
it.
that too. Yep.
Oh, that's the worst.
The
So
employee gets to just be like, well, it's not working. Bye.
bye. Oh, today I was walking around and I'm like, I have to mop. Oh, I don't want to mop, but like I have to mop right now. And it's a thing, right? So there's considerations.
Well, I divvied up chores with my students because, if they're going to go out on their own, they're going to have to do this in their own place too. So I have a list of things and people do stuff.
Yeah. I am very excited that when my students are go-getters and that kind of stuff, it's a beautiful thing. In the weeks that was just the transitional time between one class to the other, I was like, oh, good. And that was a little rough. Hold on. Did we say how long did it take you to establish regular clientele? I don't think we
No,
did.
we
Let's
haven't
talk
done that
about
one.
this.
Okay.
How long did it take you? And how hard were you trying? When you're trying to establish, let's just use the new technician schedule of somebody coming in. How long does it take you to fill their book?
About a month.
About a
I would
month.
say about a
And
month, and they're pretty full time.
Is that a wait list that you're filling it from, or is that no? Okay, very cool. So
No, our wait list is pretty low, which is good. I think we're at a good amount of staff for the demand, and I'm able to get consultations in and rebookings. So it's floating pretty well. It takes about a month for me.
about a month. Yeah, I would say a month to 2 months, depending on how much time I'm dedicating towards it. In the busier practice, it was about a month. Right now, it's about a month and a half to get a schedule to about 30 hours. And I feel like 30 hours is a pretty busy electrologist schedule of actual epilation time. That might not be like just your admin time. You might have 40 hours work that week, but 10 of that is like just your general things that you have to do as a technician. But I would say it's about a month and a half right now. Now that we have a lot of these insurance cases coming in kind of consistently, I do see where it could very easily become a lot less very quickly. So it's like, do I ask for additional time from the technician that's here? Or do I put that into some of the senior student schedules so that they're transitioning into their own spaces? But I can see that it's like starting to shift. And I think that's more about establishing yourself in that new space. Like when we talked about opening a space of your own, it just took time for people to know that we were here.
Yeah, and that's what I was going to mention too. Like me adding somebody to my business and filling their schedule, I already have a very established business that people are researching online and calling all the time. And so it's easier for me to fill my employees' schedules because I already have the flow of business. I'm already on your Google search page. I'm already, I've got the reviews. I've got like all the stuff. So it's easier. If you are starting your own business from scratch, you have to build that rapport and that presence. And then clients will slowly trickle in. So I think that it's pretty normal for people to take like a good solid 6 months to maybe like be 3/4 full. And probably by the time you hit your first year, you're probably like, all right, now, I'm full time. I might need some help.
Yeah.
So it's two different cases, right? I already have an established business, so clients are already coming in. I just open more availability for the flow of clients that are coming through. You're establishing a new business. You have to get yourself online, have to get the SEO to be on point. You have to start getting some reviews. And so you're begging your first couple people for like your first 3 reviews, right? If you could probably do it. And so it just that ends up taking more time, I think.
Yeah. And like when I think about like a brand new electrologist out of school, when you are getting close to that last, like, so say for example, you're in a 600-hour program, so you have 400 hours of hands-on. In that last 100 hours of your program, you should be starting like the coming soon process online, opening your wait list for individuals. You should be because you're still in school, so you should be hitting spaces where you're doing like downtown business meetups, and you're establishing yourself in that area. When I first got to my new demographic, like every Friday morning, there's a thing called merchant meetup. It's so funny because I thought it was talking about like merchants, like people who sell stuff, not realizing that the woman who organizes it, her last name was Merchant. And so merchant meetup is just a whole bunch of the downtown businesses where they get together Friday mornings and they have a cup of coffee and they talk about upcoming things. Well, my upcoming thing was me, right? The training and the clinic and da. And so it got people really interested in that space. And then I did the same thing with the Chamber of Commerce. Local LGBT groups. I was meeting up with different providers. There was a naturopath in the area that works with women with PCOS. I went after that one. Went after, that sounds wrong. You know what I mean? Like I established myself in those spaces. Every time you do that, grab emails, like build your email list so that when you get your license or you're ready to launch, it's bam, hey guys, books are now open, accepting consultations, and hit them with the consultation. So like you're doing that as you're finishing up school, getting yourself established as an up and coming technician in the area. You're talking about this is where you should be looking about where you're going to be renting from and that kind of stuff, so that you can see will you be filling a need or will you be adding to another clinic? Like you need to figure out where that space is going to go. You need to, when I say market, Joanie had a student a couple years ago that got really good about.
I was just going to bring her up because of like, she just really knew what she was doing with that.
She really did. And she came to a full schedule. To the point where
she was doing a lot of reels. She was big. I mean, she was her old job before coming into electrolysis was social media marketing. So that's what she did. So it was easy for her to do that. Not everybody is going to be very like attuned to it, I guess. But she did what you said, like you build your website, which actually I just added that as a requirement. I made a senior project, and that's going to be, I want them to build a website, want them to do a business plan. And so building the website is because I know that's something you're going to need anyway. And she did the coming soon. She did, she had a presence on Instagram. I don't know if she had a TikTok or not, but whatever. And then she had a join the wait list type of deal. And when she got close to being licensed, she started actually reaching out to these customers on her wait list, booking consultations. And by the time she was licensed, I think her first week or so, 2 weeks, she had 49 consultations scheduled.
Yep.
So, I mean, imagine, opening your doors. I think it took her in a matter of a month or two, she was booked solid. I think more than solid. So
and I would also attribute that to the fact that that's why she achieved burnout very quickly. Yeah. Because and this is what I mean, if you're good at it, right? If you're good, okay, don't be so good that you cannot serve yourself, right? That's a huge portion of it. Because you're taking on a lot as an electrologist when it comes to emotional labor of your clients and starting a new business for the first time and all that kind of stuff. You need to have time for you to feel good. So you can be really good at establishing these leads, but also understand like, what can I take on right away and not kill my brain? Like 49 consultations in that first couple weeks of service is insane.
Mhm.
That's a big book. And that's not to say everybody's going to sign on, but like, that's a big book
Sure.
to
Yeah.
and a lot of mental labor. So make sure that you like pace yourself, but in that pacing, like when we tell you guys about building your business plan, it's important to do so. It's important to look and see where you're needed, like, because that's how you build your client. But you can have full books pretty darn quickly. Do you want to be someone that takes on big cases, small cases? Who are you going to be talking to? Like heavy volume work? Or are you talking to eyebrows and chin? Right. And that's kind of the things that will help you. Okay. I know that we have a couple minutes left. Do we have any questions? Outside.
I've got a quick one.
Yeah.
But back to having employees, or W-2 employees. Do you guys have like a specific person that's not an electrologist that handles like taking care of all the tools, or is that something that's like shared just among everyone?
That is shared.
It's shared.
Not
that I don't see the benefit in having one. And not just the tools. I mean, that would be like my receptionist would be the person doing it. I don't need a person just for tools, but yeah.
In the larger practice, I had kind of like that reoccurring, like this person had on this day, this person had on this day. And I divvied it up on their days off as well. It worked well in that space. Especially when you have team players, right? If you always have the person that's dropping off their tools, but never doing the rest of it, that gets a little frustrating. So as at the school, it's so different. It's part of your requirements of sterilization and sanitation to like do the work, right? So it's a little different right now. I did teach my spouse everything about electrolysis. Aside from him not really wanting to do a lot of epilation, he knows how. He's just like, I'll show it when I have to. Like, it's just not it's not his vibe. He loves running an office. He loves being like the person that is taking care of all those nuanced things that drive me bonkers. He'll do sterilization when there's not a big classroom, just because it's something that he likes to do. But having a front desk person, if they don't really know how to care for it, you really do have to train them on that. Because I did have a front desk person and they were the queen of dropping forceps on the tip of the forcep into the basket. And it was like mind numbing, to be honest. And I don't want to tell you every time, especially when you're really good at being a receptionist, to please be careful with the tools so that I can do the work that you're booking me. So that's the thing. Any other questions?
I don't have a question, but my very first student to graduate took her licensing exam today and she passed. Very, very exciting. So now she'll sit for the practical exam, but she studied hard using the IBEC book, the new Milady book. She said the Milady book was invaluable for the electricity part and the skin part, more so than the IBEC book.
That
thought I'd share
new
that.
Milady book is bomb.com.
Yeah.
Yeah.
Yeah. I'm way to go, Joanie.
Yeah.
Thank you.
So are you in your state, is it NIC or IBEC for your licensing test?
It's the IBEC.
IBEC, got it.
Mm.
Yeah. Joanie and I have the NIC as ours.
So the My Lady book is perfectly enough.
Yeah.
Yeah.
What I would love to see is NIC being like the baseline, just because it has such a long standing in so many different avenues. I like the IBEC in regards to getting additional certification on top of it. I would love for it to be, it doesn't read like a true study guide. And so
No.
a
It's
lot
more
of
like a collection of articles.
exactly. And so that's a little bit frustrating. And I would love, I know that Joanie and I talk about it all the time, but like, I would love to be able to see a shift in how we study for that, because I think that a lot of people struggle with just having the IBEC as a license exam when you don't have a pathway for research.
Right. Well, I think it's a little different. It's their, I think they have a state licensure exam and then they have the CPE exam. I think they're different, but I don't think they are that different.
They're not that different because I just am test writing for it.
Yeah.
And yeah.
So, I mean, I know that people in licensed states, some of them, you know, say they don't need the CPE, but I mean, I have one. I've had the CPE exam almost, you know, as soon as I could get it, I got it.
Yeah.
Or, you know, the CPE credential. I just think it puts an added bonus to, you know, the professional.
Totally.
For sure.
It sets you apart.
I tell people all the time, you will see me always thrive, like go after as many credentials as possible because I want to catch them like Pokemon. Like I want them all. There is a benefit to that. Like I know that's just me being, it's seriously weird, but it is a thing. I feel that the more you apply yourself into these spaces that others might not be willing to, it just levels you up every time. So, and the CPE was all I had as a non-licensed state. Like originally that was like, you know, and you can pass it if you apply yourself. If you are trying to get yourself going for a certification test or licensing exam, outside of like our training platforms and whatnot, there's also Grammarly, not Grammarly. Hold on. It's not
Quizlet.
Quizlet, thank you. I'm like, Grammarly is going to, that's like testing my, how bad did I type this out? So Quizlet is amazing. During your study time, I would opt in for the upgraded version so you can unlock more stuff. And it has stuff for the IBEC as well as the NIC exam and the one from Society of Clinical and Medical Hair Removal. So it's very beneficial. And then the other one is Speechify. It's a huge, like, especially if you struggle with like long format reading, little neurodiversity in your brain, it does help you intake that information much easier. You can also upgrade it. A couple of my girls, they did like Snoop Dogg help them study. I think you can have like Morgan Freeman help you. It's like, so the voices, they kind of captivate you a little bit more. So if you're struggling to get through those article-based like IBEC study guide, it is a huge asset to you. So, and it's not that expensive. So when you're going to study for something like that, you know, you're talking maybe like $40 a month for the two platforms during the time that you're studying hard for it. So that's it.
Right. Well, I think that's all we have for today. So it was a little bit longer.
All right.
Bye.
Have a good night.
Bye, everybody.
Bye,
Have a good
everybody.
evening.
Thank you.